Here we are going to focus or overview some of the medication commonly called narcotics or analgesics. The common use of narcotics or analgesia, they used to relieve the moderate to severe pain. So the narcotics here we also call opioid. Narcotic basically promote the sedation. It is agonist. It is analgesic as well, pain reducer. So here we can see some of the common drugs name and generic name what we used as a narcotics or analgesic and what are their common side effects. The common drugs in pharmacology we use as a narcotics, as an analgesic or opioid are morphine, hydromorphine, codeine, oxycodone, and methylidine. Let me go one by one. First one is morphine. So morphine is very strong agonist, but they have some side effect. Like your patient need to give the morphine. Before to give the morphine, we have to check the respiratory status. Most of the opioid or narcotics can cause respiratory depression. So when you monitor the respiratory status, we could hold the medication if respiration are below 10. Respiratory rate is less than 10, we have to hold and talk to the healthcare provider. Because morphine or other opioid or narcotics have a chance to develop respiratory depression. The morphine or methylidine, hydromorphine, or codeine all have some common side effect. What it is? The common side effect of all of these, they can cause alter vital sign, means hypotension, bradycardia, right? And all of them has a strong addiction may occur with a long time use. So they can cause blurring of vision, bradycardia, confusion, or constipation. Also, distension of urinary bladder, or you call urinary retention of urine. So easy way to remember the common side effect of all narcotics or opioid: A, B, C, D, and S. A stands for altered the vital sign. Alter the vital sign means they reduce the blood pressure, we called hypotension. They reduce the heart rate, pulse rate. B stands for blur of vision, and B stands for bradycardia, and C stands for they can cause constipation. So when you deal with the patient who are taking the opioid, watch for develop that constipation, tell them to take enough fluid, fiber contained food, and do some exercise like walking. They can cause confusion. And D stand for distension of urinary bladder. D stand for they can cause dizziness, right? They can cause dizziness or retention of urine, or we can call stasis of urine. So this is the common side effect of all of them. Now I'm going to go another medication, hydromorphine. So you see the name is morphine, and this one is hydromorphine. This two is not same. It is important you have to know. So as like the morphine, hydromorphine also reduce the respiration, and this, but hydromorphine is not like the morphine. We cannot interchange morphine or hydromorphine, because hydromorphine is many more stronger than morphine. Very important. Here is one important point. If your patient have a pancreatitis, it is good not to give them morphine for pain medication. What about the codeine? So codeine is an opioid, but they have a properties we can use as a cough suppressant. But when you take, your patient should take the codeine, tell them take with food. Why? To prevent the nausea and vomiting, because codeine has a side effect. They can cause nausea, vomiting, but when they take with food, lunch or dinner, they can avoid it. The other most important drugs we use is called meperidine, or some books say mepidine hydrochloride. That other name is called Demerol. Sometimes NCLEX would ask. So meperidine, we do not give to the patient with the head injuries. Why? Because head injury patient has a chance to develop increase the intracranial pressure, and meperidine also increase the intracranial pressure. Another medication we use here called oxycodone. Oxycodone has acetaminophen in it. So acetaminophen and oxycodone properties is same. So do not give if the patient has allergy to acetaminophen. So when you take the history from the patient, if you see your patient have an allergy to acetaminophen, it is not to give them oxycodone as a analgesic or as a opioid if they need to control the pain. So, but it is okay to give if the patient has allergy to aspirin. We can use the oxycodone. So now let me read it. What are the other common side effects of all kind of narcotics or analgesic? We already saw A, B, C, D side effect here, but what else? What the others? they can cause. So what are the other side effects? Other side effect risks to develop the dependency. So I told you that chance to develop addiction, right? So addiction may occur if you use for a long time and patient develop the dependency. Nausea and vomiting, pinpoint pupil, diaphoresis, central nervous system depression, dry mouth, itching, and rash. So now I'm going to go another medication what are including in opioid. Another one. So opioid, another most common drugs we use called tramadol. Tramadol has also have same common side effect we called A, B, C, D, and also have a chance of develop the respiratory depression, dizziness, nausea, and constipation. I want to recap something, then go next. The all opioid promote the sedation, and they are agonist, and they also use as a analgesia. So a drugs called triptan. Triptan is TCA, tricyclic antidepressant, but triptan has a properties we can use as an analgesic as well. Like sumatriptan, commonly used for migraine type of headache. So triptan or sumatriptan prescribed for reduce or remove the migraine type of headache. What are the common side effects of sumatriptan or triptan? It is actually aminotryptophan. They reduce the blood pressure, we call hypotension. They can cause the tinnitus or photophobia, we call photosensitivities. Also have a chance to develop dry mouth. And now let me explain about NSAID. We call non-steroidal anti-inflammatory medication. The common use of NSAID, I said we use the common NSAID for mild to moderate pain. It can reduce the high body temperature. We can use for the fever. It can use to reduce the arthritis like gout or rheumatoid arthritis pain. Also, they have a property to reduce the inflammation. Okay, is a common use. Here are some of the drugs commonly we use as a non-steroidal anti-inflammatory medication like ibuprofen, indomethacin, naproxen, celecoxib. So NSAID, let me tell something more. So it is good, take with food, and they will cause GI ulceration, and do not give NSAID with aspirin together. It is good to avoid aspirin and NSAID, any kind of NSAID, not together. And also stop taking 1 week before any kind of surgery. And they can cause, all of them They can cause ototoxicity or photosensitivity. So how you understand your patient has an ototoxicity? They complain ringing in the ear. It is called tinnitus. What are the other common side effects of NSAID? All of them: ibuprofen, indomethacin, naproxen, or celecoxib. Common side effect: they can cause nausea, heartburn, vertigo, oliguria, diarrhea, dizziness, hypertension, and gastric or duodenal ulcer with bleeding. So gastric and duodenal ulcer, this is the most danger and most important. And definitely, if we see patient have a GI bleeding or ototoxicity or phototoxicity, we could notify the healthcare provider. Let me talk a little bit about the naproxen. Naproxen used as a mild to moderate pain or reduce the fever or arthritis like gout, rheumatoid arthritis, or they also reduce the inflammation. As like other NSAID, naproxen good to take with food because they will cause GI ulceration or bleeding. So when you give your patient naproxen, check the blood stool because this is a sign of internal bleeding. So if you see the patient stool color is black, terry color, or mixed with blood, it indicates internal bleeding is occurred. You have to notify healthcare provider. Now going to focus some NCLEX tips or what are the nursing implementation, right? So basically, when you give this opioid or analgesic or NSAID, what are the most important? So narcotics: report the problem, urinating such as pain, difficulty of urination, frequency of urge of urine, or decreased urine output. So after using the narcotics, if we see any kind of the problem like here we explain, we could notify healthcare provider and keep documentation. Constipation, headache, diplopia. Diplopia means double vision, nightmare, maybe sign of overdose. So if your patient have a overdose of morphine, overdose of meperidine or hydromorphine or fentanyl, codeine, we use antidote, and this antidote we call naloxone, common one. Avoid with the other medicine that causes the central nervous system depression, because all narcotics, all opioid has a common side effect. They can cause respiratory depression. So as a RN, LPN, monitoring the respiratory status is the most priorities. And we hold the medicine if the respiration are below 10 per minute. Also, it is important the narcotics, it is good not to use with monoamine oxide inhibitor or antihistamine. like diphenhydramine, loratadine, cetirizine, not to use, or also not to use with muscle relaxant like cyclobenzapine. The NSAID or non-steroidal anti-inflammatory, good to take with food, monitor for the sign of bleeding, and it is good avoid with aspirin and anticoagulant like warfarin, coumadin, or heparin. Avoid, tell your patient if they took this kind of medication not to go operating heavy machineries or not to go for driving. Also opioid, when time comes to stop the medication, it is good not to stop suddenly, taper dose, and then discontinue. Some note about the triptan. Triptan prescribed for migraine type of headache, like sumatriptan. It is the TCA, tricyclic antidepressant medication, but they have a properties of analgesia. So if your patient has to take the triptan, it is you could educate, avoid with the patient who have ischemic heart disease or uncontrolled hypertension or stroke or TIA. TIA stands for transient ischemic attack, or PVD means peripheral vascular disease, not to take with this disease and triptan together. This is very important information regarding narcotics or analgesic or opioid.